Welcome everyone to today's webinar. I am Anuja Vaidya, Assistant Editor with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. We will also have poll questions throughout the webinar. You can submit your answers by clicking on the options that appear on the screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Our presenter today is Mary Ellen Fortenberry Moore, Central Regional Manager for Healthmark Industries. At this time, I'm pleased to turn the floor over to Mary Ellen to begin.
Thank you, Anuja, and welcome everybody. I'd like to welcome you on behalf of Healthmark and Becker's and certainly hopes this finds you all safe in our new world. And at this time, quality really is more important than ever. So to ensure our patients and our coworkers remain safe. So we're going to really talk a lot about the ST90 quality management system. And I know it says 2017 and I know it's 2020. But it was first published in 2017, and it really talks through what a quality system could look like. So the disclosure, I am an employee of Healthmark Industries. I'm involved with the manufacturing and distribution of medical products to healthcare facilities and healthcare professionals. No compensation has been received for this presentation or for travel to and from. All opinions are those of mine, and they reflect the techniques, approaches, and opinions of the individual, which is me. This sponsored presentation is not intended to be used as a trading guide or promotion. Before using any medical device, review all relevant packaging inserts, particular attention to the indicators, counterindications, warnings, precautions, and IFU. Today we're going to discuss quality management system history, give a little background in history, describe a process for identifying standards, define the general objectives of a quality management system and how you would want to document those, identify resources and information for effective operations and monitoring, and then really what's the cost of poor quality outcomes. So our first poll question, we'd like to find out who is attending today. Sterile processing professionals, OR nurse professionals, surgical technologist professionals, infection preventionist, endo, supply chain, vendor or manufacturer professionals, or another profession. Take a few moments, we'll get everyone's answer before we move on to the results. All right. Well, it looks like we got a lot of other professionals out there at 52% and a good portion of sterile processing professionals and infection preventionists. So I'm glad to have you all, and I think we're going to have a good time this afternoon talking about quality. So really, a little history of quality. It dates back really to the medieval times, if you think about it. And what's interesting to me about it, they actually had what the unions called guilds in the late 13th century, and they had inspection committees. So way back in the 13th century, quality was a big deal. And originally it was, they often placed a secondary mark on their goods after they produced it. So again, a certain mark meant a certain amount of quality. And so we do that today if we really think about it. Every time we assemble a set or we inspect an instrument or we do a procedure, we put our quality on it, our quality mark. So the history of quality, we had the craftsmanship, the factory system, and the tailor system. And then we got to World War II where everyone came together and put together a quality system. And then we got into the early 20th century. And I'm from Michigan, home of Henry Ford, so quality means doing it right when no one's looking, and isn't that the truth? We always have to remember that. Edward Deming really is what we would consider in the 20th century the father of quality. And I like some of his statements because I think it really boils it down to very simple standards. If you can't describe what you're doing as a process, you don't know what you're doing. And isn't that true? A bad system will beat a good person every time. And we've seen that happen in our profession. We've seen it happen in the workplace. It's not enough to do your best. You must know what to do and then do your best. So I'm a huge fan of Deming and have been for years. So quality always matters. So you look at, not only does it matter in an outcome, but it also matters in how hospitals are reimbursed. So under programs set up by the Affordable Care Act, the federal government cut payments to hospitals that had high rates of readmissions and those with highest numbers of infections and patient injuries. So they're identifying those that had higher rates than normal, and they're going to penalize them. The patient safety penalty costs hospital 1% of Medicare payments over the fiscal year. Well, if you think about it now, we know a lot of our hospitals are in trouble with our current situation. They're not able to do surgery, so they're hurting on that revenue side, and if they're getting dinged on this side, it certainly isn't very helpful. So CMS penalized the worst 25% of facilities, 1%. That's almost 1,800 hospitals. If you think about that, that's a lot of hospitals that got penalized knowing that they had high infection rates and readmission rates or patient injuries. That's kind of a staggering number if you really think about it, and how many of those could really be prevented. We had 110 hospitals had been penalized all 5 years of that program. So no improvements over 5 years. I don't know about you, but I certainly want to be a patient in one of those hospitals. So LEAPFROG, I think most of you have heard of this, started grading hospitals a while back. This happens to talk about the spring 2019 grading system, and they assigned A through F grades for more than 2,600 U.S. hospitals. And again, it was based on the ability to protect patients from avoidable injuries and errors in infections. So I'm going to use Michigan. I'm from Michigan and give you an example of how a number of them were rated. So a total of 81 were rated. 26 earned an A. So you certainly, boy, you'd be pretty proud to put an A up on the fridge for that. 29 earned a B. 25 earned a C. Nobody earned a D, but one hospital received an F. Would you want to go to the hospital that received that F? And as a consumer, most likely you're going to try to figure out who got the A's and who got the F's, right? So their grading, really, it's nonprofit. It uses 28 key measures when they're doing this of patient safety. So again, they're looking at 28 different measures of safety within a hospital. So getting a good grade does matter. It matters if you're a hospital. It matters if we're a worker. It matters if we're a patient. It matters all the way around. So again, the grades do matter. Nationwide, 33%. So this is throughout the nation, across the United States. 33% of hospitals earned an A. Well, that's great, but what about the rest that didn't earn that A? Again, we had less than 1% got an F, but you know what? A good majority of the hospitals were under an A. And I don't know if I'm getting a new knee, or I'm getting a cardiac cath, or I'm getting a scope, I want to be at a hospital that has an A. So Amy, for years, realized there was really a need to put a quality management system and recommended practices into place. So most of you are familiar with Amy, and is a nonprofit organization founded in 1967. A very diverse community of 7,000 plus professionals. They're all united for one important mission: the development, management, and use of safe and effective healthcare technology. So they're really there to help guide us. We're all familiar with, hey, ST79, right? That's been the Bible for years. Well, ST90 is the Bible now for quality. So really it talks to, and it kind of came out in 2017, the processing of healthcare products, quality management systems for processing in healthcare facilities. How did it come about? Richard Schull and Damian Burke co-chaired the AAMI Quality System Device Processing Work Group. And again, it was a very intense work group that worked for a number of years on really deciding, to put the guardrails on what we would want those systems to look like. In November of 2017, Richard Schull, at that time the Director of Clinical Education Services at STERIS, wrote an article really citing the potential benefits of implementing ST90. And Richard was very active in thinking about getting SPDs ISO certified. And if you think about it, I live in Michigan, as I said. I drive down the expressway and I see all sorts of automotive plants. And we talked about grading for a hospital. Well, I see automotive plants got these big ISO, right? ISO certified, don't they tout that in all sorts of manufacturing facilities. I don't see any ISO or I got an A flying above any hospital when I drive down the expressway. And if you really think about it, where is it important that we really have a quality system built in? And it's certainly healthcare. So the purpose of ST90, provide guidelines for procedures and records designed and planned to support a quality management system. So again, really documenting is really going to be key here, and we're going to talk more about that in how and why we're processing the medical devices in the hospital or other facilities. For years and years, we heard about, hey, if it's not clean, it's not sterile. But if you think about it, all of our testing was really focused on biological testing, right? Making an assumption that the products going in and the instruments going into the sterilizer were clean. Though we didn't have a really good quality process on the front part of our processing, meaning were we testing our equipment? Back in 2000, nobody was testing their washers, right? Very few, if any. So if you think about that, we really had that process a little backwards. We really need to be paying more attention to the process in the beginning to make sure our instruments are clean, because we know the whole process, right? It's a circle. It's all tied together. And if that instrument isn't clean, it's certainly not going to be sterile. So what is our quality process on the front end? And I'm going to talk quite a bit about that, because that is, I feel, one of the most important aspects of a quality management system in sterile processing. So the scope of this is intended for sterile processing personnel and specifies minimum, and I'm going to say minimum requirements. I'm also going to say, hey, start somewhere. Start small, but start. But so these are minimum requirements for a quality management system, or QMS, in healthcare organizations to effectively, efficiently, and consistently process medical devices to prevent adverse patient events and non-manufacturer related device failures. That's what we do every day, right? So small steps. This happened to be one of my customers, and every time they would open a new bottle of alcohol, they would make sure they dated it, right? Because there's some expiration that could come with that. When was it opened? That type of thing. So again, these are little steps, but they are in the process that helps us with those good outcomes. So, everybody's got that user error, right? From human factor perspective, people make errors when they don't understand their expectations, or more importantly, when large inconsistencies exist between processes. And we know this happens, right? Mary Ellen's a tech in the department, and she does one thing her way, and she thinks it's the best, and then Sally next to her does it a different way. That's an inconsistent process. That will actually generate more errors than we want. So, leads to our next poll question. Are quality procedures being built into your work process? For example, visual inspection, insulation testing, each and every time a set is assembled. Yes, no, or I'm not sure. Okay, I am excited to see the results of this, and this is great. Look at that, almost 76% have built-in quality process into their workflow. And we're going to talk a little bit more about this as we go on. So congratulations. I think that number is great, because really without it, again, we have those inconsistencies where you have, a missing instrument, a broken instrument, and things like that. We've all experienced that. So we're going to talk about some terms that we want to know and understand that are in ST90. Installation qualification. And this, and I'm going to get a little story of why it's so important. It's the process of obtaining and documenting evidence that the equipment has been provided and installed in accordance with its specifications. So how often we buy a piece of equipment based on what somebody told us, right? That, the salesperson said it does this, this, and this, and that's our expectation. Well, how are you going to test that? So my suggestion is, before you buy equipment, one, you're going to define what you want that equipment to do. But more importantly, in your RFP or your purchase order, however your system works it, you write in what those installation qualifications are. So if it's a sonic and it's supposed to have cavitation, you write in your specifications how you are going to test for cavitation. And I really strongly urge this, because I've experienced where customers have been very disappointed because they bought a piece of equipment and it didn't perform as they expected, because Mary Ellen, the sales rep, said, hey, it's going to do this, this, and this. Always make sure there's backup and information provided along with that. That's a very important part about installation qualification. Operational qualification. So the process of obtaining and document, again, evidence that installed equipment operates within predetermined limits. So is it supposed to go to a certain temperature in an instrument washer? Is it supposed to have a certain cold water rinse? Is it supposed to have a lubrication cycle? Is that 3 minutes? Whatever. Those are the things that need to be happening in the operational qualification. So again, two very important steps, and a lot of times they get overlooked in, when was the last time you really tested all of your equipment for all of its operational effectiveness? So then performance qualification. So obtaining and documenting evidence that the equipment, as installed and operated accordance with operational procedure, consistently performs in accordance with predetermined criteria, yielding the product that meets its specifications. So example, every day, right, the recommendation is, when in use, we're going to test our equipment. What is our equipment? Well, our equipment is our instrument washers, our sonics. And we'll get into what are we testing in our sonics and what are we testing in our instrument washers. But again, are you just checking the box, or are you feeling confident that performance qualification is being met? And are you going back after major repairs and taking a look at, hey, did I retest that piece of equipment so it's working properly, or did I just take the tech's word that it was fixed right and start putting instruments back through it? That's probably not the best thing to do, or a good thing in a quality management process. So don't be the box checker, and we all know it's, how will you justify your needs? Understand what you're attempting to do. Are you using a surrogate device to test your piece of equipment? Do you really feel that it represents, if you're putting it through an instrument washer, that it represents compromised stainless steel with blood on it? Is that what your product that you're using to test that, is that what it's representing? Do you have that level of confidence when the instruments come out on the other side, right? I got a teammate on the other side. I want those instruments to be safe for handling, right? That's what we all want. So what is the recommended practice? To understand that. And what is clinically relevant to what you're testing? I just talked about, you're putting stainless steel with blood. Hopefully we've rinsed that blood off, right? But we're putting that through our washers. And how are you recording your process? That's the other part of it. And we'll talk a little bit about the options are. You don't always have to have, a fancy computer system. So products for compliance, understand the products that you're going to be using and why they're a good product, meaning, are they a surrogate device? Are they testing for what you want? Do they meet, ST79? Do you feel confident that it's an effective product? Product quality assurance testing. Quality assurance testing of routinely processed items or represent a product family. So again, we talked a little bit about, are you putting stainless steel? Is that part of your test object, right? Because the majority of instrumentation you're putting through your washer is stainless steel, for example. And to verify that the process being used by a particular family on a particular product family is working as specified. So again, what are we testing with, and do we feel confident that that test is doing that for us? Because we got a lot of other things that could, we have the 10 factors in cleaning, and we have all of those could go wrong at any given time. So we certainly want to make sure in our equipment as part of that, that's working as we need it and we intend it to. And we all know machines are, they can break. So the quality structure is you're going to have a quality manual. And, don't get carried away with this. Again, start somewhere. It's a high-level guidance that defines the scope of the quality management system. And what are your critical business functions? So often when I'm asked, Mary Ellen, I don't know where we should start. We have so many different things and I have so many different problems. You know what? Start at the beginning. Start with your instrument cleaning process and move it through. Or you might have an issue. Maybe, your issue is I have torn wrappers all the time. So maybe now that is going to be your focus in your quality system, and you're going to put together a process that eliminates that or minimizes it. So again, every hospital and every facility is a little different, but focus and start small. And think about, what is that footprint going to be? Is it going to be just sterile processing from the receiving of the instrumentation through the delivery of sterile instrumentation? Or is it really that whole cycle? How the instruments are prepped in the OR? How are they sent back down to SPD? What is the scope? Who's on your quality team? So again, operating procedures and work instructions continued here is very important. Detailed information on specific procedures and process. So often, and I can tell you I'm guilty of this myself, I'm not the best teacher because a lot of times I skip a step in telling somebody something because I've already done it. I don't even realize I've done it. So again, having a detailed written process and reviewed by more than one person, right? Everybody looks at it a little different, and you want to make sure you capture all those steps. And you know what? It's okay to put a process in place and realize, oh my gosh, we missed this. Let's go revise this process. The key is communicating that. So how to descriptions for completing procedures shall be documented equals it's a required procedure, right? So if we put that in shall be documented, then we always want to document. Documentation is vital because we know if it's not documented, well, it never happened. And then reference for the document. If you're referencing ST79, ARN, APIC, or ST90, what are those references? And it could be SG&A and in other facilities, even CMS. Records, data, and checklists continued. So documentation, evidence that procedures and work instructions were followed. How are you going to document that? If you do have a computer system, can you use that for documentation? So for example, I have an orthopedic shaver and it needs, the IFU tells me it needs to be inspected internally after every use. So do I have a checkbox either on my count sheet if it's manual or in my computer system that says, hey, before you finish wrapping this or putting it in a container, you must visually inspect and verify that it's clean, and I have to check that off. So again, is that part of the work instructions? And shall be recorded equals required recording. And again, the reference documentations, again, which include accreditation, certification guidance, ANSI, ANI, input states. Okay, what are we putting into our system? The quality management system is a living system, and it requires continuous review. So it's not that manual you write and you put on the shelf and you pull it out when Joint Commission comes along. This is something, it's a living, breathing document that is constantly changing, and it should. As instruments change, staff change, competencies change, that's why it's a living, breathing document. And then regulations, legal requirements that must be followed are both generic and industry specific. So these can include the CDC, FDA, OSHA, state departments of transportation. We're really getting into a lot of that right now, right? We have a lot of, say, N95 masks being transported. How are they getting transported? So you have a lot of organizations putting recommended practices in place. So validate your processes. Sources provide manufacturer's instruction for use. There's a great product out there. It's called OneSource. I wish I would have thought of it, I might add. But there's a lot of customers that I have that says, well, Mary Ellen, I go, do you have all your IFUs? If I go in and really try to help them get ready, say, for a Joint Commission visit, and I'll take a look and they'll go, oh, you know, we have OneSource, so we have them all. Well, that's great, but do your employees know how to use OneSource? It's one thing to say it, but I'll tell you, you need to be able to go in and they need to be competent in how to look up an IFU. And are they available in decontam? A lot of times they'll say, well, yeah, we have OneSource or we have this, but they're not available in decontam because of the area. So how is somebody supposed to look up that IFU or the work process if they don't even have that computer or they don't have a binder back there? So again, in demonstrating the understanding of the IFU. So that's a competency within itself. Standards reflect the best demonstrated practice. And just by the sheer fact that you're on the call today shows that you have a high level of wanting to emulate best demonstrated practices. And we get that from a lot of our recommending bodies or our regulating bodies as far as recommended practices, but we also get it from each other. You know, that as we get together, and I know, you know, Isham canceled ARN, we haven't professionally been able to get together in the same room, but we're getting very inventive how to get together, right? Whether it's Zoom or webinars such as this to really exchange best demonstrated practices. You don't, on a quality system, always have to invent the wheel yourself. Use your colleagues, use other professionals, reach out to your vendors. They are more than happy to help you with this process. Safety concerns always should be at the backbone. I mean, we work with, you think about it, even a cart washer can be a very dangerous piece of equipment, right? Some of them you have to walk in, and if you don't know how to hit a shutoff or things like that, how often do you have those competencies and requirements? So based on concern for safety, in the safety of our teams, we want to make sure we document that. So examples are the Joint Commission, AORN, APIC, SG&A, Isham. There's a number of them out there that really talk to it. We have chemicals in decontam. Do I have the right PPE? In what my hospital provides, do I feel I'm protected? Or are they buying the cheapest thing they can? And you know what? I always get strike through on my gown in decontam. You know, here's an example. How much do you care for your employees when an eye wash station, first of all, if I had chemicals in my eyes, how am I going to get there? I'm not going to see it. I don't know that I have to then turn the faucet on. It's supposed to be hands-free operation. Plus there's stuff in the sink. So again, quality is all about the whole process and what we have. The photo on the right is compliments of my friend Stephen Kovac. You know, for years I worked for a company that did instrument repair, and I can sharpen a scissor, but there's an art to sharpening a scissor. And if you look at the scissors on the left, one scissor, the one on the right, has a considerable amount of metal that has been taken off of it. So that could test as a very, very good scissor right now, but after a few uses, it's useless. So again, having a quality partner. So, you know, the person that's sharpening your scissors is just as important as the technician in your department or a manager or certification. There is a difference. So they're in quality cost. So if I can make that scissor last 5 years versus it's only going to last 6 months because Mary Ellen was sharpening them in the street, that's a big difference, and it cost. It costs a delay in surgery. It costs frustration of our customer, all the way around. So quality does pay. The other question I get a lot is management responsibility. And management has a huge responsibility for a quality management system. They need to be active in the quality management system, and it's got to be documented. And again, this is more evidence-based, or more evident now than ever. So they have to be communicating to the healthcare organization the importance of patient safety, which they do, meeting statutory and regulation requirements and establishing the quality policy, but they have to be involved. And we'll talk a little bit more about it. So that brings us to our next poll question. Do you currently have a quality program that includes management, chief operating officer, or other executive staff that are represented? Yes? No? I'm not sure. This is a great answer. So almost 100% have management included, and we're going to talk about why that is huge in making a quality system a sustainable and a repeatable process. So that is great. Congratulations to all of you. Very impressed with that number. So when you need more time, more employees, more money, more equipment, having management involved in the quality process also helps you when you get to this point where, you know what, I'm not able, so let's just use the shaver example again. I'm not able to inspect the inside of the shaver in accordance to the IFU because I don't have an inspection scope. This is where you're able to document that in your quality that you can't meet the IFU, and with management's involvement, they're going to go, well, if you're supposed to do that every time, how do we know it's clean? And you have that dialogue. And the next thing you know, they're going to help you with getting those resources. So again, management is responsible to review the input of the agenda items. So again, they're a very active member. Review shall include a minimum of both positive and negative feedback from stakeholders. So you know what? In some places, it might be the risk management. It could be infection prevention. I think the best team is a group of like-minded. So you're going to have infection preventionists, risk management. You have whoever your management representative is. Maybe your operating room, because they're probably our biggest customer, or labor and delivery. But think about who do you have on that team. But you really want them there, and you're going to come out with some really good decisions and information out of your quality. The other thing is competency and training. And I know this gets harder and harder. I just recently learned of one of my larger customers had to cut their education. And to me, that's sad, and it wasn't made in a quality environment. Because if you can't do continuing training and competency, we know how complicated these surgical instruments are. You have the robotic instruments now. You have new staff coming on. You have old staff that's been there. Have they been trained on these new instruments, and do they really know it? So again, competency, educating, training states, new employees should be provided with a structured training program designed to ensure the development of their competencies to successfully execute established process and achieve safe quality products. So again, how are you going to be able to do that? And if you can't do that, you're able to document that in your quality process, and hopefully you're going to rally to get some additional either funding or resources to make that happen. How do you document your competencies? Don't be afraid to utilize your vendors out there. If it's RAP, if it's Sonocheck, whatever it might be, call them in and help you with those competencies. In some competencies, are you doing them annually? Are you doing them quarterly? How important are they in that whole processing of your surgical instruments? Do I feel that certain steps are so critical that I am going to do it quarterly? So again, those are the things you want to think about. So let's talk about how a quality product would help us if we were installing a new sonic irrigator, and hopefully some of you are. What to test And what are you going to document? So I gave the example earlier. One of the things, define what you want your piece of equipment to do prior to sending it out for RFP, or even if you've already, say your healthcare system is established a preferred vendor. Again, what do you want that piece of equipment to do? Document it and how you're going to test it. So one, the vendor's clear on what your expectation is and how you're going to test it. You don't want them to come back and say, well, that's not a very good test. Well, why isn't it a good test? So installation qualification, process of obtaining and documenting evidence that equipment has been provided and installed in accordance with its specifications. So the vendor comes in, or whoever's going to install it, your physical planner, your biomed, they're going to test that piece of equipment and document that it's working as it should before you ever put a piece of equipment through it. And then what else we got to do? We have to train our staff. They have to become competent in using that piece of equipment, and they're also different. Unfortunately, I was at a customer site last week, and they had a great sonic irrigator. It was, I think, one of the better ones. And they had two of them, which they were very lucky. A lot of departments have old equipment. These were relatively new, and no one in the decontam knew how to work it. When I said, well, which cycle do you use for Da Vinci? And they go, oh, well, I use this one. It was a 5-minute cycle. So again, they weren't sure how to use it. So it just the opportunity to do some additional competency training. And the IFU is really a source that helps you create your competencies, and also your vendor can help you with this. So within the IFU, it uses the words qualification testing and routine testing. You want to see that in your IFU of your testing products. So again, you don't want to be the box checker. Performance qualification, enzymatic auto dispensing, checking output. If it's supposed to cavitate, which a sonic irrigator or a sonic washer is it cavitating, and how are you going to prove that? Is it cleaning? Am I using a surrogate device with, represented test soil? If I'm using a lumen, and this is the biggest one I've seen, is people are not testing the retroflow or the flow to make sure it's flushing when they connect their lumens / Da Vinci or, laparoscopic lumen instruments. You need to test for that as well, because a lot of the earlier machines, when you hook all 10 up, say I have 10 instruments in there, the retroflow is greatly decreased from instrument 1 through number 10. Sometimes the pump isn't strong enough, but you wouldn't know it unless you tested it. So instrument number 1 is getting really, really clean, and instrument 10 isn't clean, and you know what? I have no way of knowing that. And the next part of that is document, document, document. We're always going to document. In operational qualification, what are you using each and every day that tells you, yes, this, so I did my installation and I did all my other qualifications, but operationally, I got to test this every day. I'm going to use it and document it. So how are you going to document, where you're going to document it, and is the product I'm using really getting me the results I want? And you know what, really the best test is a test when it fails, right? If it always passes, that doesn't really tell you a lot, unless there could be underlying problems if you don't have the right test, right? So we want to make sure we're using the right test and the right piece of equipment. So if you don't do it, if you do it, you must document it. Again, it can be a manual system, it can be an automated system, and I'll give you a few examples on how people are doing that. Our next poll question. So given this crazy time we're in, and all of us are under stay-at-home orders, and the majority of us, have you started doing non-emergent surgical cases, i.e. elective surgeries or procedures? Yes, no, not sure. So 78% of you have started doing cases, which is great. It's great for all of us that our patients are able to get in there, our staff's able to get in there, we're able to start generating some revenue, and it looks like 20% are still waiting to start up. So things are starting to open up for us. So that's a good thing because we want to help those patients. So let's talk a little bit about how we created some examples, how we record a quality management system. This is just a really simple process that one of my customers put in place, and it might be a little hard to see, but this is how they test their washers with the TOSI. They happen to have a 4-level, but if you notice, they've labeled each one of these racks. So it's very deliberate of where the rack goes, the washer it goes in, and the shelf it goes in. So again, anytime you can eliminate that human error out of the process or somebody deviating from the best demonstrated practice, something as simple as this is part of your management system. So it doesn't have to be just crazy charts and graphs and all sorts of things like that. It's really the simple things that get down to our basic operational processes. So 6 major steps. You want to identify your critical business function. And if we're talking SPD, it's really the manufacturing of sterile instrumentation and product. Identify and document procedures for each function. So every function is pretty complex. You just sit back and decontam. You got the sonic. What do I do before I put instruments in the sonic? Do I have a 3-basin sink? How deep is my sink? Do I have medical air? All those things go into that process, and where are they? Identify and document recordings showing compliance to your procedures. Again, where are you going to do that? Communicate, and that's the biggest thing. I think sometimes we get so busy in getting that next set out or that next case cart or that next flex scope that we forget about the communication, the training, and the implementation when we bring something new in. Did materials management send you a new product? And you know what? I didn't even get the IFU on this. I don't know how it compares to the former product, and I don't know how I'm supposed to use it. Monitor accuracy and efficiency of procedures through quality inspection and review. I know a lot of you had the opportunity while things were down and slow to be able to go through and do some quality monitoring within your department by pulling trays and scopes and things out of storage, sterile storage, to see if they met your requirements. And I think that was great. Monitor accuracy and efficiency of procedures through the quality inspection and review. How often are you going to do that? And do you have that built into your process? That's really critical because we do get so busy with the day-to-day, but if we don't do those things, are we really doing the right thing for the patient? Review and revise procedures and document to ensure applicability. They change, products change, instruments change. We have to change with it. Plan. Identify, again, your critical business functions, and we all know what they are. Identify and document procedures for each function. And this takes a while, so don't think, you know, you're going to sit down and in 3 months this is all done and the binder's on the shelf and you're good to go for your next inspection. Again, it's a living, breathing process. And identify and document records show compliance to your procedures. So how are you going to do that? So this is an example. How well do you think this humidity and temperature monitor really is working? There's 2 of them there. I bet you they have 2 different temperatures and humidity, and it's thrown in with a bunch of other things. How much does somebody really care what this is measuring, right? So again, we want to communicate, train, implement, and record, and double check it. This is a very, very simple, I love this. I was at a customer, and you know, it's as simple as what is a long cycle? But it goes through and tells them what's going on. So it's not that complicated, but how often I go in and I ask somebody, well, how long is your washer cycle? Or how long is your basin cycle? And they don't know. And they don't know there's different temperatures and why. Well, you got your enzymatics that need to be at a certain temperature. You got your, you know, rinsing. So there's a lot that goes into it. So it can be as simple as that. Everybody's job. This picture on the right, I absolutely love it. I give an example. A lot of people do this because, again, a lot of your chemicals and your detergents are behind the scenes, right? And they're all automatic. I love when I ask a customer, oh, how do you know what it's dispensing? Well, it's automatic. Well, automatic means it can break. So we need to check it. And one of the ways they do this is they mark their detergents every day. Well, to go one step further, I had a customer that was doing this, but then their testing was failing on a regular basis. So their tests were coming out of the washer failing, but they went back and their detergent was right, the temperature was right, everything was right, but there was still something wrong and they couldn't figure it out. Well, what happened was one of the tubes that brings the detergent into the machine got close to a pipe that was a little hot. It melted it, so the detergent was being pumped out, but it was being pumped behind the washer, never got inside the washer. So again, they used a test, but think about all the different things that it took to get them to realize that, because they went back and they said, well, geez, I'm getting my detergent dispensed, but my test is failing like it doesn't have detergent. Then you look at that picture on the right, and this is a nice, I don't know what collection. It was taken in decontam. I don't know a lot of decantams that are using Swiffers, but I don't know. Can I find the right brush in there? Is that really a quality system? Again, you know, look at the environment that we're in and what we're doing. So check. You want to monitor accuracy and effectiveness of procedures through quality inspection and review. Whose job is it? Well, it's all of our job, but who's documenting it that they've tested it? So, example, you want to make sure that the tests being performed have been performed. Did they do it? Was Mary Ellen assigned to checking washers, or was she assigned to biologicals? Were they done? Were they read? Were they documented? Who's in charge of that? I love this picture, and I'll tell you why. It was a workstation that a customer spent, and their team. So this was a team effort. They wanted to create workstations that were exactly the same. So it didn't matter if you were on workstation 1 or workstation 8. It was always stocked, and all the items were in the same place. And it took them months, and this was the final outcome. So everybody on the team had a say in where things went. They tried it. They revised it, they tried it again and revised it again. So again, it's ongoing and breathing, but what a great way that you know you come in, all your supplies are there, and they're always in the right spot, the same spot in every workstation. So it doesn't matter which workstation you're on. This customer happens to use their instrument management system as a way of documenting what their test results were. So again, hey, this is a cavitation test. It passed or it failed. TOSI test, pass, fail. Chemical check, pass, fail. Again, they're able to document it in the system, but even if it's documented in the system or it's manual, who goes back and makes sure all of that was done? Now this is not a very good quality system. Don't be that guy or gal. How would you ever find anything in this, and how often have we seen it? Because you know what, we got behind doing other things, but what happens if you had to recall a load? Well, I think it's going to take a little bit longer, and more instruments have the possibility of being used on a patient. If it was a failed load, we wouldn't want that. Equipment, check daily when used. So again, your washers, is it working for the intended purpose? How are you going to test? Are you testing time, temperature, water flow, documentation? Is it really cleaning? You know, this happens to be another bad example. One, I've never seen so many instruments dipped in my life. They're very colorful, but I took this picture as it was ready to go into a washer. So again, this isn't it's an example of a very, very poor process. You know, you got the solid container there on the top. How are those instruments going to get washed? And those on the bottom or in the tray on the front of the picture, none of them are really open. You can't, there's a lot of shadowing going on in there. So again, there's probably not a really good defined process for putting these instruments through the washer. Opportunity for improvement. Cart washer. What are you testing? You should be testing temperature and water flow. Every piece of equipment we need to test when we're using it daily. Sterilizers, we know we've been doing this for years, you know, the Bowie-Dick test, biologicals, time, temperature. You know, have you tested your steam? When was the last time you tested your steam? Peel tacks, you think about it, we use them to catch-all for everything. And are we checking that? That heat sealer, every day it's in use, we should make sure that it's working properly. Is it sealing my peel tacks? That's a sterile barrier. You know what? Here's a picture of, you know what? It's not. If you look down in the bottom there, it's an ink test. It's migrating into where it should be sealed. So if it can migrate out, things can migrate in. So you need to repair your heat sealer or get it adjusted. So again, audit. You always develop a system to audit your process and use those team members that you have. Use the management representative, use the infection prevention, risk management. They all want to help in the quality process and define those responsibilities. And then when you find opportunity, define your corrective action. Document your corrective action. Adapt your IFUs to the QA form for auditing. A lot of vendors have those out there. I know HealthMark does, will help you with it. Again, you can use that to create some of your quality process and documenting some of your quality process. Reporting, critical. Ability to identify when testing was not completed or documented. Again, whether it's manual or automated, how are you going to do that and who's responsible for that? Can you pull reports if you had to pull a report? If someone says, give me the last 30 days of testing, is it easily accessible? Can you get it? Can you summarize it? Okay, now to another poll question. When will you start implementing scheduled, non-emergent, or surgical cases / procedures? Already started, next week, 2 weeks, 3 weeks, not sure yet. Already started, so we're right around 67%. So a lot of folks are getting back into action, and that's really good to see. And it looks like there's still about 20% aren't sure yet, and a few that are ramping up. So, and that's kind of what we're seeing out in the field a little bit, that things are starting to ramp up. So good news for all the patients out there. So I said, what's the cost of poor quality? And we talked about it a little bit, but again, CMS is penalizing hospitals. 58% of penalized hospitals were located in southern Michigan, and that is just an example. How many headlines have we seen? I don't care what part of the country you're in, we're looking at headlines, you know, that patients were infected because of a dirty scope, you know, super bugs. Look at COVID-19. I mean, there's no better time now than to really amp up your processes and your quality built in to those processes. You know, and like I said, every day you almost can see a list of dirty surgical instruments and what it's done to hospitals. And you know what, with OR being the #1 or #2 revenue maker in most hospitals, and that's why we're seeing a lot of the hospitals right now having financial difficulties, right? You haven't been able to do surgeries. You certainly don't want bad publicity regarding your patients and their outcomes. Not only would you get dinged by the government, but you're going to get dinged by your customers because you know what? They're not going to come. But when you have those quality systems, I dream of the day when I'm going down the freeway again and I see a big hospital that signs, we have the cleanest scopes in town. And I think we're going to get there. I think patients, especially in the environment we live now, are going to start to demand those things. They're going to want to know about quality of their instrumentation that's being used. They're not just taking our word. So I like to talk about Deming again. It's not necessary to change. Survival is not mandatory. And God, are we learning that? Failure is only the opportunity to begin again and more intelligently and reform. The secret of getting ahead is getting started. The secret of getting started is breaking your complex, overwhelming tasks into small, manageable tasks, and then starting on the first one. Mark Twain. Quality is never an accident. It's always a result of high intentions, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives. William Foster. So HealthMark's philosophy is we really believe An educated customer is a good customer, and it's not about buying a product. It's about running tests that are clinically relevant and evidence-based. So I thank you today for your time and your dedication to what you do every day, and know that it's appreciated. With that, I will open it up to see if we have any questions out there.
Thank you, Mary Ellen, for that great presentation. Unfortunately, we are a little bit short on time today for a question and answer session, but I would love to get your final thoughts before we wrap up the webinar for today.
Well, again, start small, one piece at a time, and any questions or thoughts or, boy, I'm not sure this, please don't hesitate. You can reach out to me, mefortenberry@healthmark.com. Reach out to your local reps. All of us are really here to help and support you. I was back there doing instruments myself, a few years back. So again, quality does make a difference, and we make a difference each and every day. And again, thank you for what you do and appreciate your time today.
Thank you so much, Mary Ellen, for your excellent presentation, and thank you to Healthmark Industries for sponsoring today's webinar. That is all the time we have for today. I also just wanted to thank our audience for engaging, especially with the poll questions. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Take care.